because you don't know what's going to happen. They may have a bowel movement in the middle of it. They may get scared in the middle of it. They may start falling. Maybe that bed rail, you thought it was up, but it wasn't, and you went to turn them and they start falling. So it's always better to have a second nurse. In nursing school, you will team up and give baths together. It's just easier. And sometimes if they can help you, you can do it by yourself. I'm going to go over the supplies with you first. As far as linens, we want several washcloths, 3 or 4 washcloths, at least 3 towels. When I give a bath in the real world, I just go get a stack of each, okay? Because you just never know what you're going to run into when you get there. You don't know how wet they're going to be. They may have a bowel movement in the middle of it that you have to clean, and so you need extra towels. So it's always better to have more than have to run and go get it, right? Okay, so you're going to have those towels. The linens are going to be your bath blanket. This is what we're going to cover them with. Not all facilities have this. If you don't have it at your facility, you're going to use a sheet, a top sheet. This is what we keep them covered with to protect their dignity and their privacy. Okay. When we remove their linens, we'll cover them with this. I try to stack them in the order in which I'm going to use them. Okay, and they're folded in a certain way, because when we unfold this, we want to start in the center and unfold out. We don't want to do this. What does that do? It just spreads microorganisms, okay? So we don't ever do that. I know we do that at our home, but don't do it in the hospital setting. We're going to need a fitted sheet that goes on the bottom. We're going to need a fitted sheet. We're going to need a turn sheet or a draw sheet. Do y'all know what that means? That's what we use to move them up and down in the bed. It also protects their other. It's easier if they soiled that, we can change that one item and not have to change their entire bed, okay? All right, and then we're going to have our top sheet, a fresh gown, and a new pillowcase, okay? So always go gather all these supplies that you need before you ever begin, okay? So have those ready. These we can keep at the bedside table, okay? All right, other supplies that we're going to need are our bath basin. When we put water in this, the book tells us it's supposed to be at 105 degrees. We do not have a thermometer at our sinks, okay? So it's got to be really warm. It should be hotter than you expect to put on them, because it cools down really rapidly, okay? By the time you get this and have all your supplies ready, get them out of their gown and their top linens back, it's already cooled down. So start out hotter, okay, than you expect it to be. I am going to check the temperature. All of your instructors will feel the temperature of your water, and they may have you go back, okay? We're not going to start with cold water.
Are we going to have to go get all that out of the closet, or will it already be out?
I'll have this, but you'll have to go get your water, okay? All right, will you refrain from asking questions till I'm through?
Yeah.
Okay. So I can keep my concentration? Okay, so I want you to put about this much water in your basin. Do not fill it to the top. It will spill, all right? Besides, you're going to change it a couple of times, so you don't need a whole lot of water, okay? So we're not going to get our water yet. I'm just telling you what supplies you need. You're going to need a cup of water to do oral care. You can have a cup of water in an empty cup for them to spit in, or you can use this basin. It's called an emesis basin or a kidney basin. You're going to need either an oral swab, it depends on your patient. If you can brush their teeth, you're going to use toothbrush and toothpaste. If they cannot or don't have any teeth, you're going to use these oral swabs, okay? So I put all that together, so it reminds me. We're going to use your soap. I got this from Celine. This is what we use to bathe our patients with. It's like a mousse that we'll spray onto our washcloth. I need a comb, a large bristle brush comb. We're going to get deodorant, powder, lotion, and then if it's a male, we may get our shaving supplies if they request to shave. So we'll need this and a razor, and all these are kept in the supply cart, okay? They're disposable. And then if they have dentures or bridges or partials, make sure that you go get a cup to put these in after you clean them, or for them to take out at night. And make sure you label it with the patient's name, not their room number, okay? Okay, so that's all our supplies. Now we come into the room. Let me get this out of the way. I'm going to start with that.